either too much or too little. So in the skin, patients complain a lot of either sweating of their skin, very itchy skin, or very dry skin. So this is part of the dysautonomia as well. It can also be medications related. Sometimes patients seem to have more greasy skin, more itchy skin when their meds off rather than when their meds on. So I tell my patients to try to time it because we can simplify the symptoms just based on their dosing. But it can be just a part of their day-to-day activity where in that case, I send them to dermatology. Perhaps they can recommend some symptomatic option.
And the other component was double vision. So the eyes have muscles attached to them, and eye movement problems are part of Parkinson's disease, particularly bringing the eyes together, conjugation, to read. And so that can cause blurry double vision, especially when trying to read. Unfortunately, the medications and interventions aren't very effective in treating that component. Okay, we're moving right along. We're right on time, actually. So we're going to move into the last section. This is what I call what in the pipeline excites me most. And we're going to start with Parkinson's disease, although we're going to cover other disorders. So the first topic is potential new ways to deliver medications we already have. So it's important to recognize everything that I'm showing you is under investigation. So it is not approved in the United States and lots of them anywhere in the world. So the first one is the accordion wafer of carbidopa levodopa. This wafer comes in a capsule and it's swallowed, and then the wafer is released in the stomach and releases levodopa over time. So it is another way of extending the duration of action of levodopa. It still will be subject to some of the effects we've talked about, food in the stomach, getting the levodopa to the first part of the intestine. So it isn't going to overcome that hurdle, but would be another option in addition to Rytari and some of the other extended release forms. So that's in phase 3, last hurdle before it's submitted to the FDA for review. The next thing that I'm most interested in is the subcutaneous. So this is a little tiny needle that's attached to a patch, and that needle is under the skin, and it is attached to a pump that continuously supplies levodopa directly into the bloodstream, so it bypasses the whole stomach, doesn't have to be absorbed, and then can maintain levodopa levels, hopefully to lessen the ups and downs of the motor fluctuations and complications we talked about. It too is also in phase 3. The next is called Dopa Fuse, and this is just interesting. It still is going to have all of the issues of getting through the stomach and getting to the intestine. But just to give you a sense of the type of research going on that we and others are participating in. This is a small device that has a chip in it attached to one of your teeth and continually delivers levodopa and carbidopa. And so for patients who have trouble swallowing, patients who have a lot of issues perhaps with tablets, this might be useful, but obviously still has the issue. But just very interesting as to different types of research going on. All right, so those were the new ways of delivering levodopa. Now we're going to look at new ways of delivering other drugs. So this also is a pump. This is a pump that is the same as the previous pump I've shown you, but it's administering a dopamine agonist called apomorphine, which has the equal effect of levodopa, but doesn't act as long when it's given intermittently. But this is a continuous infusion, and so it's given around the clock and provides an alternative way to stimulate dopamine receptors outside of having to administer levodopa that then gets converted into dopamine and released. This is a dopamine look-alike drug, and it also is in phase 3. It's already available in Europe, but not yet in the United States. All right, another way of delivering is a drug that I'm intimately involved with. This is the administration of, again, apomorphine for those off times, so an on-demand treatment, similar to the pen and the inhaled levodopa that I showed you earlier. This is apomorphine that would be administered when an off time occurs under the tongue, and it is absorbed under the tongue, unlike levodopa. So apomorphine is absorbed under the tongue, levodopa isn't. So this is presently in phase 3. We're responding to some comments that the FDA had to the submission. So hopefully we'll have some news in the next 12 months. Okay, so those are the potential ways of using drugs that we already have, using them in different ways to improve treatment. Now I'm going to talk about potential new way or new ways to treat symptoms. Again, these are under investigation. And one that is most fascinating is the way to circumvent these dying dopamine cells, getting dopamine to the cells that dopamine stimulates. And a way to do that as the disease advances is to introduce the enzyme that produces dopamine directly into the cells. And this is done through a viral vector, and then it's administered, and then it enters these cells and is then able to cause the production of levodopa into dopamine into that cell that those dopamine-producing cells normally stimulate. So it bypasses the dying cell and produces dopamine directly in the cell that needs the dopamine. So this is under trials right now, moving into phase 2 trials soon, and certainly is an interesting new way of trying to enhance symptom control. Again, this would be for motor symptoms predominantly, but very interesting. Okay, so how about things that treat the underlying disease, perhaps? We've talked about ways of improving motor symptoms, but what about the underlying disease? Well, to do that, we would really need to know the cause, which we have yet to understand. But remember, I pointed out that abnormal protein, the alpha-synuclein, which is a protein that's normally there, but in Parkinson's disease forms these toxic clumps that's misfolded, and then is seen in those Lewy bodies, that picture I showed. Well, how about approaching the disease by trying to get rid of that clumped up alpha-synuclein? And so this is being investigated by a number of companies, and the approach is to administer antibodies against that protein. It would attach to the abnormal protein outside of the cells. It can't get into cells and do that. So it would have to be outside of the cells, thinking that the clumping abnormal protein somehow is toxic to the cells that are still there. And so if you get rid of it by attaching an antibody to it and getting white blood cells to get it out of there, that in some way you could slow the progression of the disease down. And so these are antibodies targeting the alpha-synuclein, so it's like an immunization. They can be a passive or active vaccination approach. And there are at least 3 trials going on now. They're all in the initial human Parkinson trial, which we call phase 2. I'll tell you that it's a promising strategy, but there are some caveats to consider as this goes forward. First, as I said, it only approaches the alpha-synuclein clumping outside of the cell. So we don't know whether getting rid of that outside of the cell clumping has any effect on the disease. And that's important to obviously understand, but that's the approach of the treatment. The other caveat is we've tried a similar approach in Alzheimer's disease with antibodies against the abnormal protein in that disorder, And unfortunately, those trials were unsuccessful and had some side effects that were problematic. So we have to move forward with anticipation, but some excitement nonetheless. Okay, so we're going to move outside of Parkinson's disease. Just a few comments on two other disorders. So Huntington's disease. Huntington's disease is also a neurodegenerative disease. It is inherited through chromosome 4. It's an autosomal dominant, so if you have one on chromosome 4, the other is normal, so it is inherited 50% of the time, passed on from generation to generation. It's associated with an abnormal protein as well, and it's a repeat of 3 amino acids, CAG. And so normally in this part of the chromosome and part of the gene, we have 11 to 30 of these CAG repeats. In Huntington's disease, it's over 30, so 30 to 40 is indeterminate. Over 40 is definite for Huntington's disease. So this CAG codes for a certain amino acid called glutamine. And so when you have this abnormal gene producing the abnormal protein called Huntington, a chain of these abnormal glutamines occur in the protein. And so they bond tightly to a certain protein in the brain and thus contribute to that brain cell dying. And so there is a therapy under investigation by Genentech that looks to affect this mutated Huntington protein. And it's called RG6042. It targets the underlying cause of Huntington's and limits the production and lowers the level of this toxic protein. And so, again, something exciting to look forward to for those families affected by Huntington's disease. All right, the last thing that I'm going to talk about just briefly is for essential tremor. As I've said, we have oral drugs for essential tremor. We have DBS for essential tremor. We also have high-frequency ultrasound that's approved for essential tremor. So drug treatment and surgical treatment. So the drugs are modestly helpful, but we still need new treatments. And so this present study that is in phase 3 by a company in Virginia called Cavion is looking at a new class of drugs that affect the transport of calcium into cells. And it's being looked at in essential tremors, firstly, and epilepsy as a secondary indication. But you'll see in one patient from this study, their initial pre-treatment circle, and then improvement after treatment at day 28. And so some interest, obviously, in following the outcome of these studies and potential new treatment for essential tremor. Okay, I think we have a little time for questions, maybe one or two.
Let's do a few questions, and then we have some great gifts to give away.
Yeah.
Sure, of course.
Thank you. I have 2 questions. The first, perhaps Dr. Alvarez already answered, but I couldn't hear it.
Oh,
So,
okay.
and that she gave a comment on what I call, I've diagnosed with Parkinson's 7 years ago, and I call it the loss of the human waste early warning system. I mean, urgency, unlimited. You indicated that there is some help for that?
So are you speaking of bowel or urine?
Both, either. Both.
So maybe Jocelyn.
Emergency with bowel function, if you bulk up, it's better. You don't want to stop things, but you can, like using like a drug like Coenzyme, which is a bulking agent, and that will help you to kind of overcome that. And then keeping that fiber content high will help as well.
But there isn't any specific drug to affect the inability to have enough time to get to the bowel.
The other question, and this affected me, was, and I've not heard much here about occupational therapy. You know, I went through Big and Loud and the stability one, but because of another illness, or another surgery that I had, they gave me occupational therapy. And it helped me far more in the Parkinson's. I mean, I never knew what a button hook was in Parkinson. And I mean, oh, that was a blessing. I mean, to be able to, you know, button my own cuffs and
So just to refresh, the comment is about occupational therapy. So when we send patients, we generally send for physical therapy, which is more direct, range of motion, gait, etc. Speech therapy, obviously, and then occupational therapy, which helps in dealing with day-to-day activities, better ways, more efficient, more safe ways of doing things. So certainly therapy should include all of those components. Usually I'll send my initial patients for an assessment across the board, and then at different times patients may need more or less of those three for recurrent treatment, depending on their specific disease symptoms. But yes, I agree completely with you. Occupational therapy is very essential. Question?
I wonder if you could explain to us those drug trial phases. Could you explain the drug trial phases and how many are there?
Sure. So the question is, what's the FDA phases? So there is, and we did a lecture a couple of years ago that went all over this, and certainly we can bring it back. So there's preclinical. So this would be in a petri dish, in the lab, in animal models. Then there's phase 1, which is usually testing the drug in healthy volunteers that just get the drug, and we check levels, we check their side effect profile, check effects on heart and blood and other things. Then phase 2 is usually first in that disorder. So in this case it would be first in a Parkinson patient, and that's usually a smaller study trying to find the right dose. And then a phase 3 study, which is much larger, maybe even 2 studies, uses that optimized dose in a placebo-controlled fashion. Usually phase 2 has placebo, but it may not. And after phase 3, it's generally submitted, if successful, to the FDA for review. The FDA comments, may send things back, may ask questions, may require different trials, and then either approves it or doesn't approve it. After approval, some companies will do phase 4 trials, which is evaluating things that wasn't part of the initial trial, to see if it's useful in a certain subcomponent or certain symptom. Next question.
You guys have discussed several times on and off timing of medications and all that. How do you reconcile that with the entire night of sleep?
Yeah. So in the beginning of the disease, you can take levodopa maybe twice a day, 3 times a day, and you